name is Allison, and I'm going to be performing a primary IV medication administration. I'm in the ADN nursing program at fscj. Very first thing I want to do is verify my physician's orders with the MAR, as well as look at lab values and patient allergies. And the first thing that I'm going to do outside the room is go ahead and draw up my flagyl. I'm going to first of all see what medication the doctor has ordered. In this case, it is flagyl. Flagyl works by disrupting DNA protein synthesis in a susceptible organism. It's used mainly to treat infections, more commonly in intestinal infections. It's to infuse at 62.5 milligrams per milliliter and through an IV for an hour. The safe dose is 500 milligrams per 100 milliliters over 30 to 60 minutes. After I've done my calculations, it has come out to 17 drops per minute. So first I have to draw up my 1 milliliter of flagyl. So I'm going to go ahead first and check the medication, verify that it is flagyl and that it's not expired.
Nothing wrong with the site. And then once that's done, I'm going to wash my hands and
clean the top.
After that, I'm going to begin the ASAP. And I have my 3 milliliters of normal saline.
Air.
So I'm going to attach this. I'm going to aspirate it. I see the return. And then I'm going to use the push
drop 1 ml
every half milliliter and administer this saline. Until it's all the way in.
Just make sure all the air bubbles are out.
And administer the.
Set this aside for a second.
Once that's done, I will reclamp.
I'm going to set this aside, and now I'm going to administer my medication.
Correction.
After I alcohol
I would have
prep it.
needed to use an alcohol prep pad before I put this on here. I just remembered that. So, yes, definitely need to do that. And then, after that, I'm ready to attach my IV. Make sure that it's cleaned off again, just to double check. And then, I need my alcohol.
And this will go directly into the sharps container. Now I'm going to go ahead and mix my meds.
Then I'm ready to attach it.
I'm going to go ahead and label the medication bag with the client's name, the date, the time, the dose, the route, and my initials, as well as the frequency of the medication to be administered. And once I have done that, I'm going to go ahead and prime my tubing.
Start my drop factor, which is 17 drops per minute. And I will just get it going in here in the drip chamber. I'll watch my watch for a minute and just make sure that it's at the right flow rate. After that, I will check the site again, just make sure that everything's okay. And then I'm going to let my patient sit, let this run for an hour. I'm going to keep coming
First
in
thing I want to do is
okay. And then
make sure everything is clamped.
Take off my gloves, wash my hands, leave the room, and then after checking throughout the hour, I'll come back whenever it's done. And then I would wash my hands, reapply my gloves, and then I would be ready to stop this, and then I would take this off. After making sure it's clamped, making sure this is clamped. And this is clamped. I should have done that before I took it off.
This up here.
There's nothing running inside. Then after
Go ahead and
that,
unclamp my tubing. Make sure this is.
After
So I can prime it.
Once
Put this over a
clamped,
trash can to catch
I'm
any
ready
extra
to,
that comes out of the tubing.
Have another 3 milliliters of normal saline to flush the IV site. So then I would use my alcohol prep pad and get this. Aspirate. And then the 3 milliliters orders, I would
I'm
do
gonna go ahead and
every
reclamp it.
milliliter stop.
And I'm first going to check for air bubbles to make sure there are none in my tube anywhere.
Once I've administered all that, I can take it off. Clamp.
If there were any air bubbles, I would continue to run until I didn't see any. Since I don't see
And
any.
then check the IV site, make sure everything's okay. If provided certain filtration.
I'm going to go ahead
And then it's the
label
physician
my
ordered
tubing
heparin. I would
with the
administer
date,
that now, but it was
time,
not ordered, so I
and
don't
my
need to do that.
initials.
And
And
after that, I would just gather all my stuff.
make sure that I had
Make sure that
everything
I've got all
before I
my
was ready to go into
syringes
the
and
room.
needles and sharps. Throw everything away.
I'm going to go
Let
ahead
the
and
patient
put
know that
this over
everything's
here
okay and that
for
their
organization.
reception was successfully given to the IV. And then after that, I would take off my gloves, wash my hands, leave the room, and I would document
And we're going to go ahead and make sure that we have all of our supplies before we go into the room. I'm going to have this. I'm going to have my 3 mLs of normal saline. I'm going to bring my medication into the room to verify that. And I'm going to have alcohol prep pad with me.
And then once I'm done documenting,
And
taking out the
bring my physician's orders and my MAR with me into the room as well. So then I would knock on the patient's door. I would go ahead and identify myself, identify the patient with 2 forms of identification with their name, their date of birth, verify that with their wristband, as well as ask for allergies. I would go ahead at this point and explain to them that we would be administering Flagyl, the purpose of Flagyl. I would make sure I've checked for contraindications. I'd go ahead and name the side effects and the adverse reactions for this medication and tell the patient to be aware of any of these, so if they notice them, they can report them to me. And make sure I have informed them they're getting Flagyl. And before I go ahead and do anything, I want to wash my hands and put on some gloves. Wash my hands, put on some gloves. I'm going to go ahead and check the IV site for phlebitis, infiltration, and the 5 cardinal signs of inflammation and make sure there is nothing there. Ask if they're in pain. And once I have done that, I can go ahead and prep the line. So I am going to first take my other alcohol prep pad. And clean the port. And clean tip of this. I'm going to go ahead and hook it up before I unclamp it. Hook up my 3 mLs. Go ahead and unclamp that. First I have to use my ASASH method, so I have to aspirate for blood return. And I see blood return, so for this I'm going to have to push every half a mil. Use the stop-go method. And I do that for the full 3 milliliters. And once I've done that, I'm going to go ahead and reclamp the tubing. Disconnect here. This is going to go ahead and go in the sharps. And now that I've done that, I'm ready to administer the medication that I have prepared. So again, I'm going to clean this port with an alcohol prep. Grab, make sure of this. Grab this. I'm going to also prep this end for get that in the site. And I have made sure this is clamped. So now that that's hooked up, I am going to go ahead and unclamp the tubing. ahead and establish my drip factor. So at this time, I would use my watch, or the clock in the room, and time this for a minute and make sure that it is dripping at 17 drops per minute. So once I have done that and established that, I am going to go ahead and take off my gloves and wash my hands, and just document that start time when I started that drip factor. And I'm going to wash my hands and ask the patient if they're in any pain, if they're comfortable, if they need anything else before I go. Remind them of any adverse effects that they need to report to me. I'm going to also make sure I don't see any allergic reactions, no phlebitis, no infiltration, and I'm going to let them know that I'll intermittently come check on them after this has run for an hour. So I'll make sure I've done hand hygiene before I leave the room. And now that I've come back after it has been running for an hour, I'm going to go ahead, wash my hands again, put on a new pair of gloves, check the site for any phlebitis infiltration, 5 cardinal signs of inflammation, and I don't see any. Ask the patient if they are in any pain, and I'm going to go ahead and prepare to disconnect. So I'm going to clamp off the tubing. And make sure it's clamped off, and take this out. Hang this up, and the next time I come back, I would obviously bring a new alligator clamp with me into the room. But I'm going to make sure that I do my flush. So I would already have had a 3mm tube of normal saline solution, and I would go ahead and clean my hubs, or clean my side of entries. And I am going to unclamp this, and I would again aspirate blood return and push every half an ml of solution all the way down to 3 mLs. Go ahead and clamp this tubing off. And at this point, after I have done this, I would check and see if there was a heparin flush, an order for a heparin flush. And in this case, there isn't. So again, I'm going to discard this into the sharps container, and I will also make sure the patient, the IV site is still looking good, no cardinal signs of inflammation, phlebitis, or infiltration. Ask the patient if they're comfortable, if they have everything that they need. And now I would go and document everything that I needed. I would document the time, the dose, the route, the frequency, the prescribed medication, my initials, the IV site, how that looked, any complications, the dose amount, and the there's one more thing I have to. There's one more thing I have to do. I think the intake and output, I'm pretty sure, is what I missed. Dose, route, frequency, intake, output, and I'll put my initials on them. And after I've done that, I would take my gloves off, do hand hygiene again, and I think that's all.